Welcome back to Plastic Surgery Decoded, the podcast designed to help you better understand plastic surgery. We take the mystery out of it in plain language. You'll find it interesting and useful whether you are already planning a procedure or you're just curious. I'm your host, Dr. Regina Newhan, and we are now into Season 5 of the podcast. After you listen to this episode, know that you can explore and enjoy many other topics, either through your favorite podcast app or through the website at plasticsurgerydecoded.com. The first 40 episodes, or Seasons 1, 2, and 3, comprise the Plastic Surgery Decoded Classics, with my singular voice covering cosmetic and reconstructive procedures, skincare, and general questions about plastic surgery. The remainder of episodes, Seasons 4 and 5, are interviews with my colleagues around the country to help you learn about the subject. A great variety to choose from. Remember that this podcast reflects my experience and opinion, as well as those of any guest interviewed. It is not intended to provide medical advice, nor is it a substitute for a formal consultation with your physician. So come along with me as we explore this ever-growing world of plastic surgery. Let's go! It's been reported that millions of U.S. residents have traveled various distances to receive plastic surgery treatment elsewhere, often abroad. Whether it's to obtain a much cheaper price for cosmetic surgery, or perhaps to pursue a procedure with a specific surgeon who is not in the same location. And sometimes it might just be about privacy concerns, not wanting anyone else to know something's being done. Regardless of the reason, it's important to explore all the details about a procedure elsewhere, and the what-ifs. What if it wasn't the right procedure to get? What if there was a misunderstanding about the surgeon's actual training or skills? What if there's a complication? What if additional surgery is needed and there's no one to do it? And does insurance pay for it? In this episode, we speak with Dr. Daniel Kaufman in Miami, who has extensive experience with the concept of medical tourism, not only providing specialized procedures for patients who may come from far to seek him out, but also helping those who had surgery elsewhere and have developed significant problems. Listen to what he has to say. Well, today I'm fortunate to have with me Dr. Daniel Kaufman. Now, he's a board-certified plastic surgeon and body contouring expert in private practice in Miami. Welcome, Dr. Kaufman.
Thanks. Thanks for the invitation. Great to be here.
Oh, wonderful. You know, you're going to be shedding some light on this interesting and really increasingly pertinent topic. But before we delve in, I would love it if you could tell the listeners a little bit about your practice. What type of cases do you typically do? What's your practice look like?
Well, I live and work in Miami, Florida, and the practice name is Miami Life. And I do everything from the neck down.
I love it.
So I do a lot of liposuction, high-def lipo. I do a lot of tummy tucks, cosmetic breast surgeries, breast reductions, augmentations, lifts, combinations thereof. BBLs, of course, actually.
Oh, yes.
Of course, we're in Miami. I have to mention that. One of the biggest passions of mine is doing post-massive weight loss body contouring surgeries. So,
Yes.
in light of all the massive weight loss that people are incurring today with the bariatric surgery, endoscopy, the medications these days, people lose massive amounts of weight and they need extended tummy tucks, body lifts, arm lifts, thigh lifts, body contouring procedures. So those are the major things that I do. And it's a lot of fun.
Yeah, that's a great service. And when I was in practice, that was a lot of fun as well. It's just kind of transforming for patients. And so you get to share a little bit of that joy and you get to be an artist as well. So,
Yeah.
Well, we're here today to talk about medical tourism. Could you explain for the listeners what medical tourism is as it pertains to plastic surgery?
So medical tourism is basically, you could take a look at it from basically two perspectives. It's the patients traveling to have surgery with a doctor and vice versa, the doctor traveling to another location to do surgery for his patients.
Yes, great point.
Yeah, and I've been involved in both aspects. These days, my home base here is in Miami, and people travel from all over the United States and all over the world, as a matter of fact, to come have surgery with me. So medical tourism encompasses all of that. It's mostly on the patient side these days. When a patient comes to have surgery with a doctor in the doctor's hometown, and essentially they have to kind of rearrange everything in their lives to make sure that they have good and safe surgery in a strange place, essentially away from their home, away from their social support network, and all those things that must be intact, when you're embarking on procedures like plastic surgery. A lot of logistics and a lot of kind of rearranging of things in your life.
Right.
Anywhere where you're traveling more than a few hours away from your home base to get surgery done is included in medical tourism. And in my practice, I have patients coming to see me from the region, from all over the state of Florida, from Georgia, from Alabama, from the Carolinas. But not only that, they come from all over the United States and North America as well, and occasionally from all over the world as well.
Well, aside from patients coming to you for your expertise, let's kind of talk about patients who are going elsewhere for various reasons. What are some of the most common types of surgery people tend to seek elsewhere?
I think it runs the gamut of everything and anything. You could think of hair transplants. A lot of people go to Turkey. That's been a famous place.
Right. There are articles about that,
Other
yes.
countries, yeah, there's different surgeries that are done in Mexico, and obviously the Dominican Republic and some of the Caribbean, the islands have been famous maybe a good decade ago for all kinds of body contouring procedures. I think these days with the rise of social media as well,
Yes.
there's many surgeons who have become famous for different procedures that they do, and a lot of patients are actually finding them online and doing their homework hopefully, and deciding that that's the right thing for me. I'm going to go travel to whatever country or state to get the procedure done. So it's not any one procedure that's that's prevalent in medical tourism, and I think there's a lot of different things that a lot of different people do, and it just depends on the surgeon and what kind of procedures the patients want.
hmm And how common do you think medical tourism is? Is it on the rise?
I definitely think it's on the rise. Again, with the advent of social media, where people are finding the surgeon that they want and really make a connection with them. Patients that come to see me, they all tell me that, I saw a few of your videos, I saw your Instagram lives, and I saw the way you talk about the different body contouring procedures, for example, and I just made a connection and I knew you were the right surgeon for me. So there's something there that, people connect with. And I think these days they're willing to travel, they're willing to take on the expense and the logistic burden, I guess, that it would take to get surgery done elsewhere. And the proof is in the pudding.
Yeah, that's great. Well, in a little bit, we're going to talk about some of the pitfalls of medical tourism, but are there potential benefits from it? Why do people do it? Now, we've already discussed that sometimes you're seeking out a specific surgeon or a specific procedure that that surgeon may have expertise in. But what are some of the other reasons? Is it always about money, or is it about privacy and not wanting people to know that you're having something done? Or what do you think?
Yeah, I think you've hit on a few of the major reasons of why people would come to a surgeon elsewhere from where they live to have surgery. So yeah, the money aspect of it, that certainly is a consideration for a lot of people. Different areas of the country have different operating costs in terms of getting surgery done.
Right.
And in certain places where there's a higher volume of procedures done, or there's a higher concentration of particular surgeons doing particular surgeries, I think money is definitely a consideration for a lot of people. But you have to consider also the expenses of travel and staying elsewhere,
Right.
for example, paying for hotels, Airbnbs, recovery houses, massages and things like that you'd have to get started with in the place where you're doing the surgery. Obviously, the flights, the transportation there and back, of course, those are considerations that must be taken into account for people as well. So the money, it's not always just, it's cheaper somewhere and then that's that. So I think with most people, and definitely when I consult with people, I always make sure that they understand that they have to account for all those expenses. Now, in regards to the regional aspects of plastic surgery, there are certain trends and certain ways that different surgeons do things in different places. I'll give you the example is people, let's say if they come from Wisconsin or Canada, for example, where maybe because of the weather, let's say, they're not allowed to expose their body in the way that people in Miami do. And in Miami here, this is beach culture, you go outside to the park over here and you see people scantily clad and, wearing very, revealing clothing, and that kind of culture permeates into the way that we perform surgery here. So people from the north, for example, they always tell me, they're like, Doc, I've been looking for someone to do my BBL, but they just don't do it right. They just don't do it the way you would do it in Miami. And I kind of have to agree because, as far as body contouring surgery in Miami, well, we love to show it off here. We
There
love
you
to,
go.
be out there and, active in the park, in the beach, and, just showing off our body parts. And yeah, and it shows in the way that we do plastic surgery. So there is that regional aspect to it. And then finally, I think probably the most important thing that you hit on a moment ago is the actual surgeon. There is that kind of connection that people make with their surgeon. And, I always tell my patients, the first thing you have to do is make sure that you're dealing with a board certified plastic surgeon, someone who has the education, the training, the qualifications to do whatever surgery that you're asking them to do. Now, beyond that, you got to make sure that they've done a whole bunch of the surgeries that you're asking them to do, that they can easily pull up their iPad or a phone and just kind of, rummage through a whole bunch of cases that they could show you. And here's, whatever you're asking for, an extended tummy tuck or a body lift. Well, let me show you of the few that I did last week. And, who knows how many I did last month and last year, so you want to have that. But after all of those things are ensured, the qualifications and the kind of background that your surgeon has, I always tell the patients, you got to make sure that you find someone that you connect with, someone that you can really have that one-on-one conversation and really entrust essentially your life in their hands, and have that kind of feel that that you're in good hands. And, it's the same thing for me. When I've gotten the surgeries I needed to get done on my person, on my body, doctors are patients too.
Yeah, there you go.
most people don't realize that, but it's true.
That's exactly
Yeah,
right.
and you have to, so all my surgeons were my friends. They were my buddies and people who I knew them, I trained with them, I trusted them, and I knew that I had that kind of connection to know that I'm sure they're going to do a great job, but even if something goes wrong, if something doesn't go exactly the way we planned, I knew that there was something there that actually cares, that actually has a vested interest in my well-being and the quality of my results. Yeah, there's no other word to describe it other than deep connection with people, and they know that they're entrusted in good hands and in safe hands.
Yeah.
And and I think that's the biggest driver of medical tourism these days. When people find the right person for the job, that's it. They know it, and they'll go to great lengths to get that surgery done with them.
Well, and it sounds like for your patients, they've had the advantage of getting to know you a little bit through social media, but there are, misleading social media accounts out there and things like that. And so we touched on this a little bit. You talked about board certification as something to help people as they're searching. But is that a little confusing to people? I mean, board certification, if we just have that little catchphrase, that doesn't always mean board certified in plastic surgery or,
Yeah.
the proper training, et cetera. What are your thoughts about that?
Yeah, there's definitely something to be said about that because there's only 24 recognized medical boards by the American Board of Medical Specialties, and the American Board of Plastic Surgery is the only one certifying doctors to do plastic surgery and cosmetic and reconstructive plastic surgery. Now, there's all kinds of other, without being pejorative towards the doctors out there, but there are other boards that aren't recognized, like the American Board of Cosmetic Surgery. And, I do a lot of cosmetic plastic surgery, which sometimes people can confuse with, well, I'm a cosmetic surgeon. Well, a cosmetic surgeon is not exactly a board certified plastic surgeon.
Right.
A cosmetic surgeon could be a pediatrician. It could be an emergency room physician who did a 1-year fellowship with another cosmetic surgeon, and they put the stamp or label on them. And some of them are very good. Some of my good friends are cosmetic surgeons, but some of them are not. And it's not the same qualification. It's not the same standards of education and training, the same rigorous training that we have to get to be certified by the American Board of Plastic Surgery. And if people want to do their homework, they can call up the relevant boards, and they all have websites and they all have ways to check up on whether the surgeon is actually certified by the particular board and what it actually means. And the best thing I could tell patients is you got to just do your homework. And funny enough, that was one of the slogans for the American Board of Plastic Surgery in recent years is do your homework. We always instruct patients, especially these days when reimbursement for surgery, for medical specialties has really gone down with the way the insurance companies have kind of taken over, the models for doctors getting paid.
Mm-hmm.
And I think cosmetic surgery has become kind of a respite for so many surgeons.
Very attractive for surgeons.
Right,
Yeah.
exactly. And for a lot of doctors who aren't surgeons, doctors, like I said, maybe emergency room physicians or gynecologists, obstetricians who, they may not make a decent living, or at least the way they see it in their respective practices. And they say, well, these guys are doing all this lipo everywhere. Well, I can do that too. Why not? Let me take a weekend course on how to do lipo, and then I can go and call myself a cosmetic surgeon. So
a little DIY, huh?
it is somewhat of that, yeah. So, you really have to be, as a patient, you have to be an educated consumer. Remember, this is elective surgery. This isn't surgery that you need, it's surgery that you want. And I often have to remind my patients of that and let them know that, listen, before you get into, on someone's OR table, you got to make sure that they're the right kind of person. You got to make sure they have the right education, the training, the appropriate qualifications to do the surgeries that they're doing.
Right.
And again, go look at the before and afters, meet with them, and ask specific questions. There's nothing wrong. I actually like it when patients ask me very direct questions. You're certified by what board again, doc?
Oh, yeah.
Where did you do your training, and how long was your training, and how many of these body lifts have you done last week and last month, and how many of the arm lifts have you done in a lifetime? Mm-hmm. And I rejoice when people ask me those questions, because it gives me an opportunity to shine and say, I'm glad you asked that question. That tells me that you're an educated consumer of this kind of healthcare. So good on you. And let me pull out my phone, my HIPAA protected, password protected, of course, phone. And what do we want to see? You want to see some thigh-plasty? You want to see arm lifts? You want to see a combination upper belts, lower belts? Here's what I did last week. Here's what I did last month.
Yeah, that's so great. Well, and we touched on this a little bit, but just talking about some of the other areas of the world where people maybe tend to go seek out cosmetic surgery, aesthetic procedures elsewhere. My own self, I've seen ads for a whole setup that they have in terms of a place to stay and people to take care of you. And it's like a package kind of a thing. What have been your thoughts about that? I'm thinking Central and South America, Mexico, the Caribbean, etc. Is a risk in that? Is that sometimes too tempting for people and maybe they don't do their homework? Or what do you think?
Yeah, so definitely people don't do their homework enough, and I've seen that over the years in my practice. And I started out doing practice in New York, and I've seen a lot of patients come back from the Caribbean, from the Dominican Republic, let's say, but not only there. Let's not only put down any country or any surgeons from those particular countries. There's I'm sure very well qualified and good surgeons in any one of these countries, in Venezuela, in Bolivia, in Peru. But I've seen patients come from all over the Caribbean, Central, South America. And, oftentimes I would, in New York, I remember in the beginning of my career, I had a bunch of patients coming in with wounds, with nasty clinical situations where they've been caught off guard. They didn't receive the proper care.
Like their surgical site broke down or broke apart.
Oh yes, I've seen plenty of those, and I would try to help them out in whichever way I could, but so often I would find that they didn't know what the procedures, they didn't know what they got.
Yeah.
They only met the surgeon on the day of surgery, or they never met the surgeon at all, which is absolutely absurd to me. Sometimes, patients would tell me about these nightmare stories of, anesthesia was a bunch of ice packs placed on their abdomen for, 30 minutes before, the other doctor comes in.
Unbelievable.
Yeah, it's just absolutely nuts. Some of the stories that I've heard over the years. And, you add to that some of the language barriers that can be there, that people just, they kind of, they do a consult with, a consultant in the practice who has a decent grasp of the English language. But then when they get there, all of a sudden, they don't meet the same person that they did the consult with. They meet different people without a proper knowledge of English language. They're forced to sign consent forms, sometimes in different languages that they don't even understand.
Excellent point.
And, and at those times, they've kind of gone in too far. They're already there. They've already paid for the flights, paid for the recovery house, paid for the, the ancillary care, the massages, the nursing care, the different things that are involved in getting surgery and getting good outcomes from surgery, or so you think. And, people get into these kind of situations, and unfortunately they, so often they say, well, I'm already here. All right, let's just go with it. Let's just do it. And that's so often how they get into trouble. Now, when they come back to their home country, their home city or wherever, oftentimes they have all these situations that, seromas, hematomas, necrosis, wound infections, things like that. And they come to a young surgeon like me back in the day. Now I'm an old surgeon, a veteran of the field, right? But back in the day, I was trying to help out everybody. And I found myself so often in just this kind of desperate situation where, well, I don't know what to do, but we got to take you back to the operating room and do a washout of the wound, cleaning out necrosis, debridements.
For the listeners, could you explain what necrosis and debridement is?
Sure. Yeah, I realize. Sorry, I'm talking to a board-certified plastic surgeon, and I figure
that's right. Yeah.
we speak the same language. But yeah, so let's educate the listeners here. So there are various complications that can happen with any kind of body contouring procedure. You're talking liposuction, tummy tucks, body lifts, breast lifts, anything like that. You can always have a seroma. Seroma is a collection of fluid which naturally happens in the body and can be persistent and can get infected. It can turn into an abscess, which is just a collection of foul-smelling discharge from infection, from bacteria or other microorganisms. You can have hematoma, which is a collection of blood, which obviously can't stay there, has to be evacuated. Necrosis is a bad-sounding word for something really bad. It means, wait for it, death of tissue. Oh my God.
Yes.
It's not death necessarily of a patient, of course, God forbid, but it's death of various levels of the tissue. You can have necrosis of the skin, of the fatty tissue, of muscles, of fascia, which is the connective tissues underlying the subcutaneous or the fatty tissue. And, all these complications, they can happen even in the best of hands, to the best of surgeons. And they've all happened to me, surely, over the years. But the whole point of dealing with complications is that, well, you have to deal with them. You have to, address them appropriately in a timely fashion. And a lot of these complications can be avoided. They can be ameliorated. They can all be managed to yield great outcomes that, number one, don't hurt the patient, and number two, do not take away from any of the cosmetic results. But the point of handling these complications is that you gotta know your surgeon first and foremost, of course. You gotta know who it is that's managing these complications. You gotta make sure that there's a system there, not only with the doctor, but the ancillary staff, the nursing care, the coordinators, the clinical staff, of course, and the non-clinical staff, the people who are gonna be on the phone answering the questions and relaying the information properly to the clinical staff, the doctors, the nurses who did the surgery, of course, and who are involved in managing the complications. So when you travel for surgery and you don't set up all these things pre-hand, you don't make sure that you got the appropriate personnel and the teams taking care of you, then so often you can get caught in these situations which are horrible. They're just devastating. And to see patients in such angst and such, extremis that they're lost, they just don't know where to go because, as I said, they tell me so often, well, I don't even know who my surgeon was. I don't even know who to talk to. They're not answering my phone calls. Doc, you gotta help me out.
Yeah. Oh,
and then add to all of that, now we're talking, okay, now you're back in New York. You went to the DR to get your tummy tuck. The wound came apart for one reason or another. You got necrosis. It's a foul-smelling, wound that you got. No other surgeon in New York will take you on because, hey, I didn't do the surgery. It's not my problem. Go back to your surgeon, lady. That's what they hear so often. And then it's me and them. And I say, well, listen, we got to do something maybe drastic. We got to take you back to the OR. Now, what a lot of times people don't account for is, well, now there's going to be the expenses of dealing with it now.
Yes.
Something that you never accounted for when you got that great deal with the surgery and the recovery house and the travel, all the big package for, just the very little money, and you could have a payment plan and all that. And all of a sudden, now you're stuck with much greater bills than what you thought you were going to get into it.
Yeah.
And it's just an awful situation.
And some patients think that their insurance might cover it because they're having a problem, but that's not the case, is it?
Absolutely not. From the insurance perspective, a lot of insurance companies would likely say, hey, listen, this is elective surgery. You chose to do this procedure. This isn't something that's a result of surgery done for, let's say, cancer or trauma, something that you couldn't control. You're the one who asked for it. Now you deal with it. And so often I've had situations where patients are caught off guard, and they try to talk to their insurance companies. But you can't fault the insurance companies for being the insurance company. This is what they do. Their responsibilities are to their shareholders and to make money.
Yeah.
So that's why I say make sure that you understand all the economic ins and outs of getting care, including all the logistics and the different things that have to be accounted for when we're talking about medical tourism. And we hit on that a little bit earlier: the transportation, the stays, the ancillary service, and all that stuff. It's something that people so often overlook, and you got to do your homework.
Hey, let me ask you this, and putting on your surgeon's hat as someone who sees patients who have had complications when they have traveled elsewhere and they've come to you to hopefully take care of them. Is it harder to care for that patient if you were not the original surgeon and you might not be exactly sure how the procedure was done or even what procedure was done?
Yeah, 100%. Absolutely, it's harder. And this is the major reason why so many surgeons refuse to care for a patient who has a complication as a result of surgery done elsewhere. And it's increasingly more difficult when the surgery is done in another country. Again, going back to the language barriers and also the standards of care in different countries. If I ever care for a patient who's had surgery elsewhere, well, I always ask, okay, well, who's your surgeon? Do you have an operative report? What actually was done? And without knowing those details, if they had surgery with me, of course, I know every little detail in there. I know which stitch I used for which layer.
Yes, of
And
course.
it's easy for me. If there's a complication, I know exactly what to do and how we face it and deal with it in the best way. And that's that. Now, if we're going back to, having had surgery elsewhere, well, I want to see what was done. I need to know what kind of sutures did they use, what kind of sterilization methods they used, what kind of preparation they used for the surgery, what techniques inside. Now we're getting to the nitty gritty of it. What kind of pedicle was used to do the breast lift, for example. How did they move the nipple from one place to another? And was that the most appropriate choice? Now, if I see that a patient had surgery with another board-certified plastic surgeon in another state, and that I can even communicate with the surgeon, which has happened many different times in my career, well, then I can be way ahead of the game. For that patient, it's a lot easier to care for them.
Sure.
And I'll be much more inclined to take on that care and to say, okay, well, I know what we can do. I've spoken to your surgeon. I know what technique they used. Here's what can be done, and here's how we get out of this mess. Alternatively, if there's no report, if there's no knowledge even of who your surgeon is, as I said before, some people tell me, well, I don't even know the surgeon's name. I never met him, but I saw his profile online. I saw him dancing on TikTok, and he looked like a good guy. And
Right.
at those times I say, well, listen, I'd be happy to help you out, but we're going into a bit of the abyss of the unknown over here. There's a bunch of stuff that we're going to have to contend with that we might not expect, that definitely we don't know at this point, and it's going to be more difficult. It's going to be a harder road to get to a full and satisfactory recovery. And what can we do about it? I'm here to help, but we have to realize the limitations thereof.
Yeah, do you sometimes have to have them temper their expectations
Oh, yeah.
because of these impediments, basically?
Yeah, absolutely. I mean, nothing's more disappointing than a patient looking at you and, they went down to the DR to get a beautiful tummy tuck and they wanted to get snatched up. And now they're in the office with a festering wound, with the sutures popping out, with, sorry to be so graphic,
No,
but
it's
I'm
people need to know.
yeah, yeah. No, I'm giving you the real deal here. This is what I've seen in my practice day in and day out.
Yeah.
And now we're here. Now we're caught in a bind, and the patient is just incredibly disappointed, sometimes even emotionally devastated. And yeah, and it's a tough road along the way. It's just we have to temper the expectations. We have to make patients realize that okay, and without making them feel worse than I tell them, I'm like, I don't want to beat you up any more than
Yeah.
you've already.
No guilt trip.
Yeah, most patients they've beaten themselves up plenty already before they get to the doctor who's going to care for them with whatever complication that they've incurred. But
Yeah.
yeah, you have to make sure that they understand, okay, it's not going to be what we've expected. Now we're in this situation. We got to hope for the best and, sometimes expect the worst, but that's okay. When we have that kind of resetting or recalibration of the expectations, I think that's a much better mental situation where the patients need to get to, and they often do. What can you do but move forward?
Do you find that when you've had to take care of patients like this who have had complications from procedures elsewhere, do you find that the patient's problems when they come into you are probably worse than they could have been because of a delayed presentation? Either they were embarrassed or they didn't know who to go to, so they just kind of let it fester and become a problem.
Yes, on all of the above, right there. So
Okay.
yeah, I've seen and heard it all by this point in my career. Yeah, so people, yeah, they get caught in these situations. Oftentimes they didn't tell their family until
Right.
they call their family when they're there, and they say mom, dad, or I'm in a hospital in some other country, and so often the family's like, what did you do, what
Yeah.
happened, and
Yeah.
then they have to kind of backtrack and tell them the whole situation. And yeah, and they get in these situations where they're embarrassed, they don't know what to say, they've hid certain things from loved ones.
Mm.
Yeah, I've seen it all, and there's so many reasons why people end up in these situations. And it all goes back to kind of wanting to get something the quick and easy way.
Yeah.
I forget who said this. It's an old saying: when you try to get something for nothing, you often end up with nothing for something.
Oh, wow, that's poetic
Yeah,
right
I
there.
know, profound, right? I forget who said that, but I wish I could give credit. I didn't invent that one
Yeah,
myself,
it's a
but
good one.
yeah, it's just one of those things that people oftentimes realize, unfortunately, when it's just too late. Which is why I go back to saying this, and the American Board of Plastic Surgery decided to make this their motto: do your homework. So if there's one message I guess we could transmit today, is just that: is do your homework.
Yeah.
Find out exactly what it is that you're asking for. Find out who it is that you're asking this thing from. Make sure that they have the appropriate education, training, qualifications. Make sure you're going to a reputable center, a place
Mhm.
where you have, where there's great reviews online, where you can actually talk to former patients. I always recommend that to my patients as well, prospective patients. I say, go on the online groups. I know there's a bunch of them out there of
Sure.
talking about me and many other surgeons. There's support groups. There's groups out there of people who have had surgery with the doctor that you want, who've had that particular surgery that you want the doctor to perform. Ask around. Patients are surprisingly a lot more willing to share than what you would think. And there is a way to do your homework, to get all the information right, and be sound and secure, and go into surgery 100% ready for it, and knowing that you made the right connection, that you found the right person to do the job in the right way, and most importantly, that they have the wherewithal and they have the systems built there, the systems intact, to take care of any problem, no matter how small or insignificant it could be, and
Absolutely.
make sure that you can get to that beautiful, satisfactory resolution, and you can get that beautiful tummy tuck, breast augmentation, body lift, whatever it is that you were looking for. I mean, plastic surgery should be a wonderful experience for all of us. We should all get the best kind of surgery in the best of hands, and the only way to get there is to do it the right way.
I love that. Well, gosh, before we wrap up here, I wonder if you have a story about a patient who came to you after having a procedure elsewhere with a significant complication, how you were able to help them and how that kind of changed their life. What could you tell the listeners?
Wow, I can, just so many patients ran through my mind right now. I'll tell you this much. Okay, so here's one of the cases that I see so often. I get a lot of patients who lose a bunch of weight with Ozempic, with Wegovy, with endoscopic, the intragastric balloon, the sleeves, the bypasses, you name it, I've seen it. People lose massive amounts of weight in many different ways.
Sure.
And then they got all these loose, sagging folds of surplus skin in all the places in the body you could think of, in the full circumference of the body. And then they get hooked up with a plastic surgeon or a cosmetic surgeon, what have you, somebody that they saw online who does a great tummy tuck. And and they're great on TikTok, and they have a lot of fun videos, and they got a great personality. And then they get offered a tummy tuck and the BBL because they want the contours of their abdomen improved. And you know what, while we're there, we're doing some lipo, let's take some of that fat and put it in the buttocks, because I hate the way the buttocks is sagging and all that. And when you've lost 100, 150, 200 pounds or even more, that is exactly the wrong way to handle the situation. We need to lift before we fill. I've seen it over and over again. Patients don't realize that with the surplus skin, the excesses of folds of skin in the full circumference of the body, doing a BBL, that might make things worse, because now you're taking saggy tissues, the frumpy kind of, sagging skin on the buttocks, it's not where it's supposed to be. And now you're going to add on more fat, make it heavier and more fat laden. You're gonna get that diaper butt, as they say, or the ant look. I know the internet comment section is a mean place. I know. I only learned these these terms from there, not medical terms, of course, over here.
Oh, yeah.
But so they get offered the wrong surgery, and then they come to me and they have the tummy tuck scar is completely just a straight line, a horizontal line. The scar is way too high, showing way too much of the mons pubis. The corners turned down. It's just awful. The buttocks is heavy and just fat laden, and the folds of skin have been made even more pronounced more unsightly.
Poorly done.
Yeah, poorly done. And then I say, well, listen, first of all, there's only so much I could do. And then it dawns on them that, oh my God, I should have had a total body lift. I should have had a belt lipectomy with Dr. Kaufman. And then I tell them, okay, look, so here's what we can do. We're going to be able to redo the belt. We'll redo the front portion of the tummy tuck. I'll make the scar a lot lower. I'll lift the mons. I'll make sure that the corners don't turn down, that they do follow the bikini line. And then we continue with the scar all the way around, and we go and we make it a full body lift, and we take the buttocks that was sagging and just so lumpy and frumpy, and we take it and we lift it. We actually get it to be in the correct, appropriate place. And not only that, don't be afraid of the circumferential scar. People think they're going to come out with a circle around their waist, looking like a Frankenstein kind of monstrosity. But no, the scar is going to be beautifully hidden under a bikini in the front and under a thong in the back. I make sure that the scars are perfectly placed so that you can always wear a teeny weeny bikini or sexy lingerie and still hide the scars. And finally, those contours that should have been dealt with appropriately in the first place, they're finally placed in the correct place. And then, we get, a complete amelioration of this, horrible situation that we got caught in. And yeah, it may not be as great as it could have been than if we were to do it in the first place, but it is what it is. And, when life gives you lemons, you got to make lemonade. So we take the situation that we got and we make the best of it. Most people, I guess, they're not as negative as we'd like to think that they are. A lot of people realize some of the mistakes that they've made. And once they meet the right surgeon, once they meet the right team, then they realize they're like, I'm at the right place. It's finally gonna look the right way, the way it was supposed to look.
I bet that's really changed their mental and emotional outlook as well.
Yeah, and I've made such, great comebacks.
Yeah, people just don't know. Yeah.
Yeah, well, and whose fault is that? We can partly blame ourselves for being maybe not good enough of educators out there. Maybe we just need to get on social media and talk more about it, be more open about it.
That's what this podcast is all about.
Absolutely, 100%. And I'm so glad, Dr. Nuan, that you invited me on this podcast, because it gives me a chance to to expose, these issues to your listeners and, whoever's out there that's listening. Yeah, just make sure that you find out exactly what the problem is. People oftentimes don't realize what the problem is. It's not that you don't have enough fat in the buttocks. It's that you have too much excess skin because you've lost all this weight.
Right.
And the same could be said of so many different body parts, areas in the body, or different surgeries that people think that, okay, well, that's the solution. Let me just get implants in there. But no, you have to do a breast lift with it, and maybe implants is not the right choice. Maybe you want fat grafting instead.
Yeah.
So there's all these kinds of situations that people must be educated on. And I think, what you're doing here and, what I try to do online as well every day is just wonderful. I mean, I think we as healthcare providers, we have a duty, we have a responsibility not only to do the right surgeries for our patients. If you look at the word doctor, it goes back to Latin. What it actually means is teacher.
Yes.
The first and foremost mission in doing our jobs, we have to educate our patients. We have to let them know, okay, here's what the problem is. Let's define it. And once we define the problems, then we can go through the correct options and all the different alternatives that we have to correct this problem. We can understand what the benefits are, of course, what the risks are. We can't avoid talking about those things. And I think if we as educators, as doctors, as true teachers of our craft, if we do that with our patients, with other healthcare personnel, people who are involved in healthcare as well, if we teach the family practitioners, the gynecologists, the obstetricians, if we take the time to teach them about what we do for a living and how we help patients out, make them realize that, plastic surgery is healthcare. It's related to mental health. It's related to all these aspects that, so many people kind of tend to downplay. I think if we do our job right, then everyone benefits. Plastic surgery is finally realized by patients and healthcare providers alike is part of, what constitutes good care for people. It helps them with their bodies. It helps them with their state of mind. And it's our job, it's our duty to do that.
Yeah, that's very insightful. That's a great way to leave it. Well, Dr. Daniel Kaufman, thank you so much for sharing your insight and helping educate our listeners.
Pleasure.
Really appreciate it.
Thanks so much, and thanks for everyone for listening.
Take care. Well, that's our show for today. Hope you enjoyed it and learned something too. Don't forget to subscribe, rate, and review. Please share this podcast with someone else who might be interested. And while you're at it, check out the podcast website for related topics to explore. It's www.plasticsurgerydecoded.com. And as always, thank you for listening to Plastic Surgery Decoded.